The touch in partner relationships becomes so very important, because a partner relationship, a sexual relationship, needs to sustain strongly. The touch will always give rise to a cascade of feelings. And a touch from a partner, a sensuous and sexual touch from a partner, will give emotions of love, lust, affection, trust. Good morning, everybody. It's very nice to be here in front of you all, and I wish you all a very lovely day. At the outset, I really want to thank the organizers, Dr. Ajay sir, for considering me to give a presentation in front of this elite gathering, especially my teachers and my dear colleagues. So thank you, the organizers, Radhakrishna sir and Ajay sir, thank you. So actually I am very touched by the gracious presence of you all here. Touch is the topic. Touch, the word itself, it generates a sensation in our body and an emotion in the heart, isn't it? I am very sure you have very precious touches which you cherish, you have been cherishing all your life. It may be the tender touch of your baby, the loving touch of your mother, grandmother, of course the touch of your spouse. And you can never ever forget the first exhilarating and stimulating touch of the girl that you had a great crush on in your classroom. So touch is something which is not only a sensation, but it will always be accompanied by an emotion. So what is touch? Touch is everything. Touch is the language of communication. It is the thread of connection. It is comfort. It is love. It is bliss. And we all know, and we all also use touch as a therapy. Touch can heal too. Touch is very essential part, or it is the primal need for survival for all human beings. It is the first and foremost sensation to develop. And when does it develop? It develops right in the intrauterine life, when the fetus is in the coziness of the uterus of its mother. And as it floats around in the cushion of the soft amniotic fluid, the amniotic fluid touches the body of the fetus, and there itself the touch sensations start forming. So right there, and then they don't stop just there, but they also go into the exploration, integration, interpretation. Also the feedback mechanisms take place in the intrauterine life itself. And what does the amniotic fluid do to the fetus? It also gives it the warmth, the touch. The warmth of the touch of the amniotic fluid gives the fetus a lot of security, where it feels very safe. And therefore this security, this warmth is later continued as soon as the baby is born. It is kept in close contact with the mother's skin. This skin-to-skin contact in the first hour of the birth has very many beneficial effects, not only on the baby but also on the mother, where it relaxes the mother, starts secreting the oxytocin, which is the hormone of love and bonding, and then propagates the nurturance. So touch is, as I said, a very essential need of all human beings. And this was proved by Harlow in 1965 by his 3 famous experiments done on the rhesus baby monkeys. Cannot go into the details, but these 3 different pictures show us that touch helps the baby to identify its mother. These experiments were done with the baby monkeys and inanimate mothers made of wire and wool. In the second experiment, he showed that the baby wants to snuggle more and more near a mother who is covered with snuggly and warm and cuddly clothes. And he will prefer that mother to, to another inanimate mother which had a bottle of feed. So touch was preferred over feed, which shows us that food is necessary, maybe food is necessary for survival, but touch is what sustains a being. And the third experiment of Harlow is very important in the context of touch because it shows us what a touch deprivation can cause in the lives of persons. And touch deprivation in the baby monkeys showed that they became severely anxious, depressed, and withdrawn. Same effects on human beings. For human beings, touch is extremely essential and an intensely valuable experience all throughout our life. Right from birth to death, right from the cradle to the grave, we all experience it, we all want it, we always desire it from our dear ones. And why is touch necessary? Because it enhances, it enriches, it softens the relationship, it strengthens our relationships and always sustains them, makes them strong. And because it has all these qualities, the touch in partner relationships becomes so very important, because a partner relationship, a sexual relationship, needs to sustain strongly. The touch will always give rise to a cascade of feelings. And a touch from a partner, a sensuous and sexual touch from a partner, will give emotions of love, lust, affection, trust. So the touch should never be the one which will say T and ouch. No, no ouch. It only should generate the ahs and the oohs. Such should be the touch, because it forms a connection between the partners. It will foster love, trust, and gratitude. What it also does, it gives the receiver a sense of self. The receiver feels worthy, and the giver has all the contentment in giving. Therefore, it's a win and win situation for both partners when touch, when the hugs, when embraces, when kisses are used more in a relationship. So touch circuits are actually very simple, but at the same time they are very complex. Simple because the touch sensation on the mechanosensory receptors on the skin taken by the C fibers of the efferent nerves towards the brain in the primary somatosensory cortex, where it all gets integrated and interpreted, and the motor response may be, that is the place where motor response will be decided. But it is not very simple. There is a parallel processing which goes on, and this parallel processing takes the complex touch information to the deeper parts of the brain, to the subcortical brain. And there is the hypothalamus, the amygdala, the nucleus accumbens, the ventral tegmental area, which, depending on what type of touch a person is experiencing, it will give rise to different types of neurohormones. And those could be, if the touch is loving, it could be oxytocin, vasopressin, dopamine. And if the touch is threatening, it could be adrenaline, noradrenaline, which generates the stress response. So, a touch, the response to the touch comes from these specific connections and these specific organizations in the brain, because that response is always it is influenced by life experiences, expectations, cultural background, context of the touch, and all this process goes on in the hypothalamus. And therefore, even if the posterior parietal cortex touch data integration is done and execution planning is decided, but all the emotions which may come from the subcortical part will ultimately decide the response of the receiver to the touch. So we can say that actually a person will never feel pure touch sensation. Because by the time a touch is perceived by the person, it is always mixed with emotions, it is always mixed with expectations, it is always mixed with memories of your experience, isn't it? And these three E's come so much in between a couple's interaction when they try to get intimate with each other. And therefore, we need, as sex therapists, we need to teach the couple, if they really want to enjoy the intimacy of oneness, the highest part of getting intimate and going to ecstasy, how to eliminate these three E's and actually get the pure enjoyment and bliss. Tense is not the right word in intimacy, isn't it? But we need not get tense. It is only our sense organs, the tongue, ear, nose, and skin, and the eyes, which are very important when we want to get intimate with our partners. Without the other sensations, there is the role of intimacy, or the full process of intimacy will never be completed. So instead of calling it tense, let us make it as an exquisite or an elevated nest of intimacy. Kama Sutra has told, Vatsayana has propagated the use of all the 5 sensory organs and the heightening of all our sensations of seeing, hearing, smelling, tasting, and feeling for holistic physical and sexual pleasure and complete gratification when two partners are meeting sexually. Keshav Das mentions, only when the eyes and speech and minds of the two persons will unite, the physical bodies will want to come together. Isn't it? So coming to the eyes, very briefly I will say, eyes act as a strongest visual stimulants. Partners need to be attractive to each other. They need to be a source of excitement and arousal to the partner. May it be the attire of the partner, or may it be the expression in the eyes of the partner, or may it be the gestures that the partner makes. The gestures, the expressions have to be very right. The other person should feel like coming towards you. Very, very important. So we need to also learn and also teach our patients to express the right emotions through our eyes. And we should be able to read the expressions in the eyes of our partner also. Very, very important role eyes play. Eyes actually break the ice when intimacy starts. Smell, the aroma, the fragrance of all the perfumes, attars, colognes that we have been using since ages. And why are these being used? Because they tantalize the olfactory bulbs and take excitatory signals to the brain. And then they start releasing serotonin, dopamine, all these endorphins, and give a feeling of relaxation. And there is sexual arousal. So we had been seeing first that women used to wear such nice gajra and all. Now the trend has come out. It was all for excitement, for attracting the partner. Pheromones, in humans, they don't play a very important role for sexual stimulation as such. But yes, for a partner, the pheromones in the body, the unique characteristic of pheromones in the partner's body can be very sexually attractive to some partners. Okay? So we should never forget that the breath also, when partners come near, their breath also needs to give out a fragrance. It should be fresh. It should be inviting. Otherwise, breath will put the brake on the loving union. Sound. Sound plays is another magical trick with the partners that they can attract. So soothing music, soft instrumental music, melodies of romance, all can play can be played in the background while the couple is trying to come near, isn't it? But also, if all this is not there, only pure and simple words of appreciation towards the partner, of mentioning some good qualities about the partner, or of just wishing or telling the partner that I wish to be in your arms today, this can have an escalating effect on the partner's mind. So sound, the use of sound is also very important in intimacy. We are not playing this video for short of time. Okay, taste. All these, we know, all these fruits, nuts, honey, chocolates, their salty, sweety, chocolatey taste brings in so much of pleasure. And with this pleasure starts the phenomenon in the lower brain and starts stimulation of secretion of all the oxytocins and preparing the excitement. So the mood builds up little by little, and that has to be. So we all know this, pomegranate and all increase blood flow, testosterone. Pan in our Indian context is very important. We have again forgotten that tradition of the wife giving pan to her husband after dinner. Why was that done? Because pan, betel nut and betel leaf, they have some qualities which will increase erection, which prevents premature ejaculation, which increases testosterone, which improves the erection. So all this is so necessary. So don't you think that the Pan Khai Saiya Hamaro tradition should actually start again in the homes, isn't it? Cardamom, of course, as I said, to freshen your breath. Okay, so now we come to the touch part, the sensation, which is very, very important, a very integral part, a very important part of intimacy, because nothing can happen without touch. All the others that we saw were the psychological pleasures. But sex is not only psychology, it is physical. We have to have physical as well as psychological pleasures. And touch is the only thing which is physical. And that is the only thing which will take you to the epitome of happiness. And as Fuller has said, that seeing is believing, but feeling is the truth. So if you want to feel something, you have to touch something. Isn't it? You have to touch your partner. You have to go into the intricacies of the touch, become very, very intimate with the partner, and then that will happen. And then the partners will take each other through all the stages of excitement, elation, ecstasy, and even exhilaration. As we said, exhilaration, as Rajbhat sir had yesterday mentioned, super consciousness. Okay? So, touch in partners should always be sensual. As I said, it should always be gentle. It should always be soft. What is a sensual touch? It is not plain touch as you would touch your colleague. It's not that. A sensual touch is laden with emotions. It's laden with emotions of love, affection, longing, bonding. Your partner wants all that from you. Sensual touch is the basis of eroticism and intimacy. And what all are sensual touches? Are the gentle stroking which starts from the face, nose, neck. It starts making the partner feel excited. The tender embraces and soft caresses will come later to that, which will form the closeness and connection. The gentle massages and then the deeper touches and then the deeper kisses will help the partner to relax further. Romance, intimacy starts coming in. And then the transition to the sexual union is very, very incidental. It is very smooth. So, but gentleness, I said, is equal to sensuousness. It is the core component in a sensual touch. How should that sensual touch progress when two partners are coming together? Should progress from the periphery and towards the center. Never start from the genital area itself. It should start from the non-erogenous zones, from the face, the cheek, the neck, the nipples, the breast, the navel, the inner thighs, and then on to the vulva, clitoris, and the penis. Isn't it? So while doing this, all sensuousness, all the fun should be included, isn't it? It's all about fun. Sex is all about fun. So including all the senses in our play of sex is very, very important. And this playfulness during kisses, during your embraces, it should have a teasing quality too. And therefore, just start your kisses from here to there and not there and back to here. Just make this thing. So it's a unique experience which will be long cherished by your partner, isn't it? Some qualities, these pleasuring sensual touches must be done at all times before, during, and after the sex. It has certain qualities of temperature, texture, pressure, speed, and context, which are also very, very important. Rough touches are not welcome. They are seen as competitive. The partner is seen as demanding, self-centered, whereas a soft touch will be very, the partner is taken as an understanding and trustworthy one. A tight touch, the pressure touch, will hurt the partner. It will cause a repulsion, whereas the lighter touches will be sexually transmitting and more fulfilling. Context of touch is what gives meaning to the touch, and situation. The context is the situation. It is the mood state of your partner. It is the timing at when you are touching the partner. So a partner needs to be very skillful to know what is going on in the mind of my partner, what is her need now, and then apply the right touch. All this matters so much. So such intricacies in this thing. Affectionate touch is very, very important. No gentle loving gestures, cheering up your partner, motivation, all the time. As Dr. Neelam always says, what is foreplay? Foreplay is the duration between two orgasms. So 24/7, this play between the couple should go on. There are lots of gains of this game of intimacy and shared positive activities by the couple. All these shared positive activities, if they are done, they definitely increase the love and bonding in a relationship. Studies on more than 7,000 couples have proved that affectionate touch behaviors increases the love and romance in partners. And all these I will not read out. These are the shared positive activities. They make the partner feel accepted, valued, cared for, enhances attachments and responsiveness. So many physical, emotional, relationship benefits that the touch gives us. We all know that stabilizes heart rate, mood, enhancing the mood, lowers the cortisol, reduces stress, anxiety, enhances cognitive functions also. So you can take out your partner out of depression if you use touch the right way. Emotional, it makes the partner feel affectionate, appreciated. It gives security, stability, and high self-esteem, improved self-esteem to the partner. So if you want your partner to feel nice, to feel good about herself or himself, touch him often. Relationship becomes close, more connected. It's a communication for unexpressed emotions, isn't it? Kuch na kaho, words become unnecessary. High relationship satisfaction. Many roadblocks in the pathway of touch, which should be dealt with in our therapies. Touch deprivation causes a very negative influence on the mind, and all this can happen: breaking of trust, infidelity, drifting apart, ultimately divorce. This picture is a very interesting story. You might read it on Google. What touch should not be is definitely should not be aversive. And aversive is all this: never arrogant, violent, empty, reckless, insulting, vacant, or egocentric. So the magic in intimacy, as the topic of my talk, is develop this sensuous and sexual touch. I am calling it a sense-sexual touch. Take your partner to the epitome of pleasure. Transcend the smoothly into the sexuality, which is very immersive and very overwhelming. And both partners reach the bliss of ecstasy. Sensual touch will give you the pleasure, joy, and fulfillment. And it is ample. The sensual touch is available with us, ample, abundant, and accessible. Respect is also important in a relationship. Without that, nothing of the above will work. Reciprocation, empowerment of the partner, sensitivity, purity, connectedness, and togetherness, trust will develop. Thank you so much for your patient listening. Thank you very much.
Thank you, ma'am. It was very interesting. So, when we wish a new couple a long and happy married life, that should be complete education from premarital to postmarital to menopausal and all that. And how to touch also should be included in this counseling.
Now, the 2 questions are only allowed. Please raise your hand.
Thank you, ma'am. We request our chairpersons to kindly felicitate our speaker, Dr. Madhumita ma'am.
If I can add to what has been said, like you said, 2 questions are allowed. The most appropriate expression that I have come across about the touch is the answer to the question, which is the biggest sex organ of the body, and the answer is skin. Skin is considered to be the best organ of the body, and thereby the touch. Very well said, very well presented. Thank you.
We all know that pregnancy